Hi, welcome back to Lisa Moss Medicare. Now, I'm a Medicare broker. I don't work for the federal government and I don't work for the Department of Medicare. I basically work for you. I'm a broker. I'm licensed with all the different companies. We have to have a health license, an insurance license, a Medicare license we do every year called the AHIP, and then licensed with each individual company. So we have a lot of different companies here in the area that I'm in. I'm in Southern Idaho. And I'm licensed with all the different companies because everybody's different. Everybody has different doctors, different things they want out of their health plan, and they have different medications. That's what we're going to talk about today. Let's talk about the different drug plans. First off, everybody has a drug plan. If you're remember, A and B you sign up for only takes care of 80%. The other 20%, you either have a supplemental plan, pays for that 20%, and a standalone drug plan, or you have a Medicare Advantage plan, which 99% of the time, it includes a drug plan. If you don't have a drug plan, and I have found several people along my journey that never had a drug plan, there are penalties, and the penalties can add up. They add up per month, per year, and they continue to add up until you get a drug plan. So you don't want to be caught blindfolded and blind in that area. Now, not all drug plans are the same, of course. They all have formularies. They list from tier 1 to tier 5. They even added a tier 6, but it's really similar to tier 1 or 2. So we'll just, for today's example, we'll just use 1 through 5. So tier 1 through 5, 1, 2 being your least expensive, and tier 5 being your most expensive in your drugs. So every plan, every policy has a different formulary that has your drugs on these different tiers. So if you take a lot of drugs, it really behooves you to make sure that you know the different drug plans and the cost of them. That's what we're going to go over now. So the first thing you want to do is take your drugs and list them all out. List the dosages and the frequencies and call somebody like me. I will put my phone number up here so you can call. I'm at 208-544-5011. Or you can go to my website, insuranceover65.com. And what we do is we take all your drugs, what you're on, the dosage and the frequency, and we put them in our system. Then we go to the different policies and we compare what drugs you're taking and where they stand on the formulary, and if they're on the formulary. I've run into many, many people that are taking a specific drug and their agent put them into a drug plan and their drug isn't on the formulary. So you know what happens? That's right. You have to pay for it all out of your pocket. Now, who wants that? Nobody wants to pay all your drug cost out of your pocket when you can switch to a different policy that it's on their formulary. This is super, super, super important, especially this year coming up to 2025. Drug plans, whether it's a standalone with a supplement or included with Medicare Advantage, they're going to change. Mark my words, coming up 2025. These plans all start January 1st to December 31st, all drug plans. So if you're in a Medicare Advantage, you have a little bit of an advantage because you can change again January through March 31st if you had made a mistake. But your standalones, no. So you want to make sure you get into the right formularies. What I suspect is going to happen, and I will do a special video on this after October 1st when they legally give us a chance to talk about it, of what these changes will be. I suspect we're going to see some more drug deductibles where you have to pay your deductible before your copays and coinsurance kick in. So the first thing you want to do, like I said, write everything down, have it in front of you and know what it is. And if it changes throughout the year, let your agent know. If I'm your agent, let me know so we can make sure that coming up for the next following year, we get you on the right drug plan. So what you want to do is you want to check the formularies. You want to put all your drugs into that formulary. You can do it on Medicare.gov. You add in all your drugs, and then you can compare the plans in your area, or contact somebody like me or me, and I can do that for you. That's the first thing you want to do, is put it in and make sure you're in the least expensive formulary plan for you. Remember, everybody's different. Everybody takes different drugs. Then you want to compare the cost of these different plans, of these different formularies. You want to look at the monthly premium. What is it? These plans run from 50 cents to $140 a month on the standalone plans. Well, what's the difference? Well, they're not linear. Sometimes the 50-cent plan is way better than the $100 plan. You don't know till you put your drugs in. Most of the time, the 50-cent plan is for people that don't take a lot of drugs. They just need a placeholder so they don't have those penalties that follow them the rest of their life. So a lot of people just use kind of a place marker of an inexpensive plan. However, I have found some people that inexpensive plan, their formulary is the best for them and they're paying the least amount of money. I'm all about saving money legally. Make sure you know the ins and outs of Medicare to save and keep the money in your pocket, not giving it to somebody else. Then you want to look at the annual deductibles. I think this is where we're going to have rubber meet the road of next year. Right now, the annual deductible max is $545. Next year, it's going to go up to $590. That's in 2025. That's almost $600 that you're paying out of your pocket for your drugs before your copays kick in. That's a lot of money. And, this year, as of 2025, our following year, you're only going to take $2,000 out of your pocket, but it's going to add up quick in the beginning if you have an annual deductible. You may not have one now. Come January, you may have one. So it's up to you to know how your plan is changing. Again, I said I'm going to do something after October 1st, and I'll let you know what those plan changes are. You can call me up. You can talk to your agent, or you can go online and find out what those changes are. There's also some co-insurance that you may pay with these drug plans. So it's important to know what your out-of-pocket costs are on each policy, so you can compare the policies, what works best for you. These policies, remember, are all different every county. I mean, I can go 10 minutes to the north of me, and it's a completely different county than the county that I'm in. I can go 40 minutes to the east of me, and that's a completely separate county as well. And if you move, say you move from county to county or state to state, your drug plan has to be changed. And it has to be changed in a timely manner in about 60 days. If it's not, you may be getting your drugs for years and you change counties. All of a sudden, you go to the pharmacy 3 months later and you were paying a $17 copay, and all of a sudden you have a $100 copay. And it's because your drug plan is no longer valid. So double check. Those are the little ins and outs that us as agents are here to help you. We don't charge a thing. We are completely free to you. We get paid by Medicare and by the companies to help you. That's our job, is to help you. Now, another thing you can do is each of these drug plans, whether it's a standalone or Medicare Advantage, have what's called preferred pharmacies. In the territory and county I live in, we have quite a few. Each plan is different. Each plan has their own preferred pharmacies. You can contact your agent and they'll look it up for you, or you can call the number on the back of your card and find out if you're using a preferred pharmacy. If you are, generally 99% of the time, it's going to be less expensive to use a preferred pharmacy than a not preferred pharmacy, and each plan is different. There's also pharmacies that you can get with each plan that actually send the drugs to you. Mail order pharmacy. Almost all of them have a mail order pharmacy within the policy. They generally will send you 90 to 100 days of that particular drug right to your home. Most of the time, it's less expensive. Sometimes, though, it may be more expensive. So, again, check in, call the back of your card, call your agent, find out. It's, $5 here, $10 there. Saving money along the line is a big deal. The coverage gap and the donut hole, you're going to go into that this year in 2024, but not in 2025. They've let go of that. If you are in the donut hole, there's a couple of things you can do. You can contact your doctor and see if there's a generic form of the drug you're taking, of the drug that went into the donut hole. And that just means you're paying much more, 25% of the drug more than you were before. And if that doesn't work, or if that does work, you can also call the drug company. A lot of times they'll send you the drug, or they'll send you a discount on the drug to help you get through your donut hole, that gap period, until you get into the catastrophic where you're not paying those high out-of-pocket costs any longer. Now, star ratings. Star ratings are important. Each plan is rated from 1 to 5. Anything over 3 is a good plan. Your 5-star plan, there's one in my area, are excellent. Those are the best of the best that you can get. So your star rating is going to make a difference on your plan and on how much out of the pocket you are spending on your plan. Again, you want to compare. You can go to Medicare.gov and put all your drugs in at the leisure of your living room with your phone or with your computer and find out if you are in the best plan for you without a pocket cost. If you're not, contact your agent. October 15th through December 7th is the time to change. Because remember, these plans run January 1st through December 31st. But you have to change October 15th through December 7th. It's really important this year. I can't stress that enough. We're going to see a lot of changes in the drug plans. And that's why I'm doing this video for you today, to help educate you on how you can save money with your Medicare and with your drug cost. There's also additional benefits. Sometimes you can get mail order options. You can get over-the-counter medication coupons. There's other things that you can do. You can also talk to your pharmacist if they have any local discounts in their pharmacy. So remember that Medicare Finder Plan Finder tool is available to you at Medicare.gov. You can contact me directly, and I'm happy to help you as well. Here's my number back up on the screen. So let me check and see if we have any comments or questions today. I know we haven't had a lot of people on these calls live, but I do recognize that a lot of people watch these calls that are recorded on the YouTube channel. Just click on the live button on Lisa Moss Medicare on YouTube, and it will play the whole recording back for you. There's a whole plethora of videos in there to educate you. Remember, you're the consumer. You worked all these years for your Medicare. So find the best plan, the least expensive for what your situation is, because everybody's different. So thank you for joining today, Lisa Moss Medicare. Next week, we're going to talk about Medicare scams. So please join in at the end of July, the 26th, next Friday at 12 noon Mountain Time, 11 a.m. Pacific. And we're going to go through that. In the meantime, have a beautiful week and enjoy every moment. Thanks again for joining. Really appreciate it.